Hello, parents. I'm Dr. Prashant Patil, a consultant pediatric endocrinologist and diabetologist at SRCC Children Hospital managed by Narayana Health. As a pediatric endocrinologist, we deal with the various hormonal problem and growth related problem as well as obesity related problem in children. So parents, are you aware that 4th March is celebrated as a World Obesity Day? And you'll be surprised to know one fact that almost 30% of India's population, which is school going, is overweight and obese. That means every one in third kid is not healthy. Either he's obese or he's overweight. And this is quite important thing to know because we have to do something about it. Now, how do you define obesity? So, just to imagine as your body as a suitcase. Now, what will happen if you try to put too many clothes in that suitcase? So, suitcase will not close, right? So, similarly, if your body has lot of fat than it could accommodate, it can lead to obesity and followed by the complications related to obesity. Now, to define obesity, we have Indian IAP growth charts and there are various BMI percentiles. So, to define obesity, we use a simple formula. It's like fourth or fifth standard mathematics. The formula is very simple. The body mass index is equal to weight in kg divided by height in meter square. And depending upon the number, we compare that BMI formula with the diagram of BMI growth chart. If your BMI is more than 23 or 23 adult equivalent, that means your point is crossing the orange line on the growth chart. That means your child is overweight. However, if your BMI point is more than 27 percentile of adult equivalent, that means it is crossing the red line. That means your child is obese and we definitely have to do something about it. Now, parents, mostly the obesity is of two types. The first part, which is very common, is also known as nutritional or polygenic obesity. So this type of obesity is happening because you have a faulty lifestyle, lot of junk food. Just to summarize, if it is too much of food without lack of physical exercise, with negative environment, with lack of physical exercise and excessive screen time equals to lot of trouble that leads to this type of nutritional obesity. The second type is hormonal obesity. So there are certain chemicals in your body like thyroid hormone or steroid hormone. If there is a excess or deficiency of this hormone, that can lead to endocrine obesity. Now please remember that this type of obesity will have some signs or symptoms specific to it, which can point towards the endocrine obesity. So most commonly the endocrine obesity, the growth will be hampered. So as we discuss, it's not about numbers. We know that numbers doesn't tell the full story, isn't it? So there are some red flag signs for the parents to identify whether their child is at risk. The number one risk factor is whether your child is snoring in night. Second, if it's getting tired very easily. And third, and the most important thing, that if there is a black patch or the velvety patch behind the nape of the neck, that is a classic sign of insulin resistance and the future diabetes. Now, why one should be worried about the obesity? What really matters? So, is that only the look? So, it's definitely not about the look. But apart from the look, it also have multiple complications like very high sugars or what we call it as diabetes. And you'll be surprised to know that diabetes also seen in a pediatric age group, that is less than 20 years of age, high blood pressure, fatty liver disease, and certain joint related problems, because obviously your knee is not meant to do such heavy lifting, and it can lead to some emotional disturbances like depression, anxiety, bullying by the kids, and multiple other problems. So, whether this condition is treatable, the answer is absolutely yes. Ideally, it has to be preventable. So, as the old dictum says, the prevention is much better than cure. So, you have to lead a healthy lifestyle, eat healthy, and as I shared in the previous short video, that I'm going to give you a secret formula. The secret formula is 5-3-2-1 rule. Now, what is 5? That you have to eat 5 servings of fruits and vegetable. 3, you have to have 3 dairy servings to control and manage your bones well. 2, limit your screen time to 2 hours maximum in a day. And 1 hour of physical exercise is must. So this is the 5-3-2-1 formula. Obviously, there are certain drugs which are available to treat this condition, especially approved for the adolescent and teenage, but with the warning that it has to be under strict medical supervision with lifestyle changes. As in life and in obesity, there are no shortcuts and there's no magic pill. So, our purpose is to create an awareness and to make it a healthier nation. Now, if you're fat, we don't want to do the body shaming, but at the same time, we also have to look after the excessive weight and thereby managing your weight properly. So please see a doctor whenever your child is getting obese in less than 5 years of age, if he's getting tired. To summarize, we just want to make you healthy and happier instead of being perfect. And even the small changes goes in big way in changing the pattern of obesity. So let's try together, parents, and build a healthier nation, make our kids healthier and fitter. Thank you so much.